Hello, everyone, and welcome to another episode of Psyched Perspectives. I'm your host, Dr. Frank Clark. I want to wish everyone a happy summer and to be mindful that July is National Minority Mental Health Awareness Month, also known as B.B. Moore Campbell's Month. B.B. Moore Campbell was an advocate, a journalist, and an author who was responsible for helping co-found NAMI Inglewood. And she provided a space for BIPOC communities who were experiencing mental health conditions so that they would have a safe space to be vulnerable and to be transparent. Which brings me to the introduction of my guest, Dr. Diego Regalado, who is a fourth-year psychiatry resident at the Greer Center for Psychiatry residency program in Greer, South Carolina. I've gotten the chance to know Dr. Regalado over his residency career. I consider him a colleague, a friend, and a mentee who is interested in addressing the health inequities and disparities that continue to exist in BIPOC communities. Dr. Regalado is very interested in serving under-resourced communities, and he's also very passionate about immigrant mental health care. He earned his undergraduate degree from Texas A&M University and his medical degree from Texas Tech University Health Sciences Center. Dr. Regalado also is a humanitarian in every sense of the word. He was a crisis counselor. He is also currently a APA Diversity Leadership Fellow, where his work reflects a broader commitment to equity, education, and culturally responsive care. So without further ado, howdy ado to Dr. Regalado. How are you,
Wow,
sir?
thank you so much, Dr. Clark. That was an amazing intro. I'm good. I'm so excited to do this.
Well, I'm excited to have you on the podcast. So, I gave a snapshot, a brief encapsulation of your bio, and obviously you are more than just your bio. So, I would love for you to tell our listeners a little bit more about yourself, maybe what people don't know about Dr. Regalado, and we'll start there.
Yeah. Well, wow, what a broad question. I don't know where to start. I guess I always start with by saying that I was born in Mexico. I first came to the U.S. when I was about 6 years old, and then I was mainly raised in Texas. Um, a lot of people might not know that English is not my first language. Usually people expect me to have like a thick accent or something. But that it was a struggle to learn English growing up. And from that, there's a large part of my life that I used to not talk about as much just because I thought, eh, no one would care to know about that, or maybe that's stuff to keep hidden. But it's a big part of me, like not being able to communicate whenever I first came in, or just learning culture, American culture after moving here. Those were all big aspects of my life that I often feel people don't know about me.
I appreciate you sharing that, and I know those things about you, but I definitely wanted to give you the space to share that. I'm curious. What are you most proud of, both professionally and personally, especially as you are now in your last year of residency? And I would love this for our listeners to hear about what you're most passionate about and proud of.
Yeah, man. I actually got a request to go speak with my high school in a couple of weeks. In September. And so I've been thinking a lot about what like high school Diego would think about what where I'm at. And I think right now I'm way past any standards that I set for myself. I'm most proud, one, that I made it through medical school, right? It seemed like such an unbelievable task to do whenever I was in high school. Everyone would go up to me and say, "Oh, that's like 10 years more of schooling. You think you can do that?" And whenever they first said that, it felt like Mount Everest. Like, who could even do this? Um, and so having been through that, not only being a doctor, but also finding a place in medicine where I feel comfortable, where I feel happy, and where I found such amazing friends and mentors like you, man, that's for sure, like, I think my greatest accomplishment so far.
Well, you are definitely leaving a legacy. Well, you've already built this legacy, and your legacy will continue even when you graduate from our program. And we're so thankful for the invaluable contributions that you made to our residency program. Which leads me into my next question. I would love for you. So I know you've been a huge advocate for BIPOC communities, especially um, notably Hispanic communities. And so I was wondering if you could talk about what being a diversity fellow in the APA has meant to you, and what have you learned about yourself, and how have you used that fellowship to continue to foster this advocacy and transforming the communities that you are so passionate about serving?
Absolutely. Being selected as a diversity fellow was a huge honor. I was amazed that I was picked for it. I think one of the reasons that I wanted to join it is because there's a special place in my heart for any person of color. Having gone through a ton of challenges growing up, whether it was issues with insurance, straight up communication issues like not speaking English, not knowing how healthcare works in this country, or even just having the stress of having to plan for the next appointment. Like, sometimes they make many frequent appointments, but to us, that was a big issue. And I noticed it a lot in like my Black friends and my Hispanic friends, my Ecuadorian friends. And so having firsthand knowledge of those struggles is what motivated me to apply for that fellowship. In it, I'm currently about to start my second year in it. It's a 2-year fellowship. And it's been fantastic in how it's brought about even more angles about how different cultures, how different people struggle with obtaining mental health. One of the biggest lessons that are sticking out to me, we had one of our speakers was telling us of a patient who was from a small village in Africa. I think it was in Chicago, and so she was found outside. They took her to like an inpatient hospital. When you go into inpatient hospitals, they try to make you safe by taking away certain things that they think could be an issue. For her, they took away her scarf, and so for I want to say several hours, maybe even days, she was very agitated, and immediately they wanted to go for medications like B52 something. When this speaker went to go talk with her, it turned out she spoke a language that was very hard to find a translator for, but just through hand signals, the our speaker found out that what she was missing was her scarf. To in her religion, that was very important to her, and so what I learned from that is that culture can play a huge part in mental health and just how we present and being aware of cultural mm, of things that are just important to different people from all around the world. That's what I've been trying to take away from in this fellowship so that I'm more cognizant of everything that's going on around me.
Very important lessons that you've just conveyed to our listeners. The importance of the biopsychosocial, spiritual, cultural model, and I feel like at times we forget about that cultural element, a person's way of life, their religion, the language. And I think also too, you spoke to something about the importance or the impact that acculturation can have on individuals like yourself, coming from Mexico to the U.S. And what we know is that acculturation can be difficult for a lot of individuals when they're immigrating to the U.S. And you talked about the language barrier and not, and how to speak English. And I think we forget how that can be very debilitating to a person and their family. It doesn't just impact the person, it impacts the family unit. What would you say to the up and coming psychiatry residents, those who are still in medical school but interested in psychiatry? What tips would you say from an interviewing standpoint when obviously working with all populations, but obviously we're talking about BIPOC communities, which have been historically marginalized since the beginning of time? I would love to hear any tips that you would give to your future psychiatry residents?
Yeah, I really like that question. I think in medical school and whenever we're freaking out about starting residency, we really focus on that review of systems, on asking for depression, for bipolar disorder, for schizophrenia, and trying to drill that down as quickly as possible when we're first seeing a patient. I found that, especially for the BIPOC communities, but even just any patient in general, that can wait to the latter half of the initial appointment. What I think is most important is focusing as much as you can on that social information part. That way, when you're asking that, one, a patient feels like you're seeing them like a person. Like it's not just another number that we just need to diagnose. And more than that, it teaches you, it tells you who they are, where they're coming from, and it's basically all the things that might amount to a diagnosis based on how they grew up. Maybe that's why they're depressed, but it doesn't necessarily have to be a chemical imbalance depression. You might learn that it was because of issues with parents growing up or with bullies. And so, above all, I always recommend that they try to learn their patients as people before going further with like medications.
Great words of wisdom. I want to get a little bit granular,
Mhm.
especially when it relates to treating the Hispanic community. And I know I've learned a lot from you as well, because I know oftentimes whether we were in the during your detention center rotation with me or other rotations, having translators and then also being practicing that cultural humility, but also being mindful that how we may ask a question may not translate as well to various communities. And so when working with Hispanic communities, we know about cultural bound syndromes. We know how like Black communities, we may experience depression differently than Hispanic communities. And so, uh, what would you say is key when you have someone who is from a Hispanic community sitting across from you? How have you found it helpful? You talked about the social history, but um, of assessing for depression or anxiety, bipolar disorder. Would you speak about that?
Yeah. So one of the things I do, this is gonna be funny to describe, but it's almost like I have a separate brain whenever I'm speaking Spanish. And so, you know, I haven't been able to do, I primarily practice in English. So my doctor brain is mainly the English one. Whenever I first see a patient in Spanish, it's almost like just my regular Diego brain takes over. When I first speak with a Spanish speaking patient, it's rare that I ask them like, "Oh, what brings you in?" It's usually like, "Oh, where are you from? What state in Mexico are you from? Or what city in another country are you from?" Without thinking, immediately I tell them what state I'm from. And so usually by the time I say that, it feels a little warmer. It feels like it's more of a conversation than them just talking to a doctor that is in Mexico. Traditionally, we see doctors above ourselves. Like we see them as not our equals. Um, and so I feel it's a combination of me growing up, seeing doctors as higher than me. Now, when I speak to patients, I want to make sure that they know we're on the same level. So it's a way of almost just diffusing that. Um, Apart from that, quickly, whether it be with Hispanic patients, whether it be with African Americans, within like the first 10 minutes, I try to throw something in about stigma, about how if we come from Black and Brown communities, there's a huge stigma that surrounds mental health. With Mexicans, it's almost seen as like, you're really weak. Why are you telling me this? Or you should be praying about this. What are you doing? Um, so I always try to throw in something about stigma really quick so that they know that I'm aware of it. And two, to push that stigma out so that they can feel a little more comfortable speaking about it. And if that doesn't work, I emphasize there's no judgment in this room. There's no judgment in this clinic. Please say whatever you want, and we'll try to figure something out.
Yeah, you're alluding to the importance of psychological safety, creating that safe space, creating that space, because oftentimes I know many of our patients, it's the first time they've seen someone who's a mental health professional, whether that be a psychiatrist, psychologist, an APP who is in mental health, social worker, what have you. So creating that safe space and allowing them permission to be vulnerable and
Mm-hmm.
acknowledging the stigma that I can relate to that in the Black community too, as it relates to BIPOC communities. That we're all going through something, and letting them know that it is okay to share, and that suffering does not mean that you. It's not a result of you not. It's not a result of you being. It's not a moral failure. It's not because you didn't pray enough.
Mm-hmm.
And really, so that's in a lot of ways you're doing advocacy right then and there in the appointment, and you're acknowledging the history and of our communities, the inequities and what have you. So that's a good thing. You were going to say something.
So I was going to say that in addition to dispelling those stigmas, um, especially with Hispanic patients, a lot of us don't really, that might be too broad of a term, but growing up, I didn't really know what psychiatry was. I didn't know what therapy was. Um, and so often, whenever I see a Hispanic patient for the first time, it seems like they're a little confused about what exactly is going to happen in this appointment. Like, will the worst case happen where we bring in a straitjacket, which like doesn't even happen at all, but movies. Um, and so within those 10 minutes, around the time that I talk about stigma, I also try to talk about just what psychologists are, what the difference is between a psychiatrist, what can be expected, what all we might talk about, just to prepare them like someone would if they're getting surgery. Let them know exactly what's going to happen so that they're not on the edge of their seat, just waiting for something bad to happen.
Yeah, that's important. A lot of times people don't really care what you know until they can trust you,
Mm-hmm.
which is part of the therapeutic alliance. So I have two more questions for you, and I appreciate your time today. My first question, I would love for you to talk about what you've been doing from an advocacy standpoint, almost kind of an influencer standpoint on Instagram. to help Hispanic communities learn more about mental health?
Yeah, absolutely. So, um, this started in January of this year, actually. I wanted to start making videos about medications. You know, a lot of our patients come in and they'll say, "Well, I Googled this medication and that's what I want," or they'll tell you, "I don't want that medicine because I Googled it and it has really these bad side effects." And so I wanted to give a perspective of like someone that prescribes those medicines or is more familiar with them than just a robotic Google answer. Um, and so I tried starting doing a medicine a day where I would just talk about the common diagnosis that is prescribed for, maybe some side effects, and I always try to throw in a fun fact, like how um, what one of the medicines, I can't remember which one right now, but one of them actually used to include lithium in it. Or sorry, 7 Up used to include lithium back in the 50s. So I try to throw in fun facts at the end. Um, what I noticed is that well, my biggest fear going into it was that someone would be like, "Oh, this is what medicines are. I'm not going to need a doctor. I'll just use this video to guide me." Luckily, that didn't happen. Instead, what happened is that people were commenting, thanking me for just doing a brief overview of a medicine they take or a loved one takes, and for just giving them kind of like a personal experience with that medicine. Um, After that, once I got a little more comfortable with explaining the medicines, I wanted to go a step further and translate my videos into Spanish. Um, a lot of the things that I've noticed is that uh, a lot of Hispanic patients that I've encountered, like on the consult service or on addiction service, is that they weren't even aware there's medicines for like alcohol, substance use disorders, or exactly what these medicines do. And so I wanted to provide that just to a broader audience. So I started translating my videos. I do one in English one day, one in Spanish the next day. Um, and then similar comments, people were thanking me like the best comment I've had so far. It's like from this church, and they go, "Thank you for what you're doing for our community. It's just nice to see this. We're learning a lot." Um, some of my friends' parents from back home, my friends will send me pictures of them on TikTok, and my friends will go, "Somehow you got my mom on TikTok, and now she's learning." Thank you, I guess, but also it's weird seeing her do this. Um, that's been one of the more fun uh, advocacy projects that I started this year.
Yeah, kudos to you, and I hope that you continue doing this even after residency, because what it says to me is that it's a testament to who you are, and you've you've never forgotten where you've come from, and I think sometimes we need that reminder of why we do what we do, and you've had this intrinsic motivation even prior to residency and medical school of just wanting to be a healer, an advocate for communities, and you have the lived experience, and so I think that also plays a role as it relates to your passion and your enthusiasm behind these initiatives. And I've gotten a chance to watch some of your videos, and so I'm very proud of you for the work that you are doing and that you will continue to do, because it is much needed. And I'm also excited that we have a diversity fellow from our program in South Carolina. So it's always good to have representation from South Carolina in the APA. So that's great. The
Thank you,
last
Dr.
question.
Um,
Oh yeah, I'm sorry. Go ahead.
one more thing I'll add. Um, so I've noticed, I've learned that education is key for everyone, right? If people don't know what's happening to them, everything feels scarier. Like if you don't know what depression is, if you don't know what anxiety, what bipolar disorder is, if you just um, let TV or kind of the lay explanations for them guide you, all of this seems a whole lot scarier. And so that was another reason for me making it, was to, provide the facts about what disorders are, what the medicines are, but also to kind of demystify them to where people can feel like, oh, only a doctor should know that. Now it's they know about it. They kind of know what to expect if they do have an illness like that, and they also know what the treatments are. So I feel like if I was, heck, I also struggle with mental health issues, so I like knowing what the medicine is, what exactly is going on in my brain, right? And it just makes it feel less scary because you have more control with knowledge.
Knowledge is important, and I'm glad you mentioned the education piece because we're living in a time where now people are they're receiving these shorts or these snapshots of everything, right? And we're all none of us are immune to that. And so a lot of times now, patients, which are all of us, we have to be mindful of where are we getting our information from. And there's a lot of misinformation and disinformation out there. And so when we have people like you who are experts in the field, and I can't imagine too that I can only imagine too that it would be very helpful for all communities, but especially Hispanic communities, to see someone who looks like them disseminating that knowledge and that education. There's a quote: "You can't be what you can't see." And I think that that is relevant in so many ways, but I think it also speaks to seeing someone who shares a similar cultural background. You talked about it being scary, and you being transparent about your own mental health can be helpful, can be life saving and life giving for all communities, but especially the Hispanic community, which you represent. So, again, I think that you are doing such a great service for humanity, and allowing people to be their authentic selves with no judgment and allowing them to breathe, which is key.
Absolutely. Sorry, one last thing.
Sure, go ahead.
I think transparency, as long as you feel comfortable with it, transparency can be incredibly helpful. For me, I don't know where it comes from, but sometimes I limit myself. And then once I see someone that looks like me or comes from a similar background do that thing I wanted to do, then instantly I'm like, oh, wait, that is possible. Let me try it. So, yeah, I have no problem telling people I've struggled with depression, with anxiety, so that they know that if you're diagnosed with that, that's not the be all end all. You can still be a doctor. You can still go on to do whatever you want. It's more about just mm, doing what you have to do, maybe going to get treatment, going to see a psychologist. But I like to show that there are no limits with whatever cards you're dealt with.
Yeah. Yeah, we all have our adverse childhood experiences, which can shape how we view the world, but they don't have to define us. And we can't edit our past, but we can enjoy the present and what we learn from those experiences. And as a part of the being part of the BIPOC community, you're speaking from a Hispanic male standpoint. As a Black male who's also gone through his own depression and anxiety, I echo the truth and transparency. I do that a lot when I give talks in the community, or even at, locally or nationally, because I think it is important for people to realize that mental illness doesn't have to define you, and just like cancer doesn't have to define someone, or hypertension or diabetes. We are not our conditions. And I think what you're doing with all the work and advocacy that you're doing, I think you're continuing to dispel those myths that we are our illnesses, when in fact it's quite the contrary. So, and I think that goes to like that person-centered language that we always talk about. It's not the schizophrenic in room 211. It's that person has a name, They have a body. They are a being who happens to have schizophrenia. So,
Mhm.
all right, my last question to you: what would, because you alluded to this earlier, so what would the Diego of now, of the present, tell his childhood self?
Ooh, okay. What would I tell my childhood self? As a fun thing, I would probably tell him to get a different haircut. That old haircut wasn't working out, but on a serious note, um, I think I would tell him to trust the process. Um, this is, I don't know if this is a cliche, but you know, everything happens for a reason. The best thing I've ever done is just trust God in everything that I do. Diego in the past 10, 15 years, oh my God, there was so anxiety with regards to so many things that felt out of control. Um, and they all worked out somehow. Or even though they seemed like they went completely against my plans, against this grand scheme that I had devised, man, they worked out way better than I could have ever hoped. And so, yeah, I would just ask them to take the moment in a little more and just trust God, enjoy the process, and keep on trucking.
Words of wisdom, and I know you are a God-fearing man, and so am I. And as you were talking, I thought about the scripture about many other plans of a man's heart, but it's God's whose plans prevail for us. So, on that note, I want to thank you for being a part of this episode, for you sharing your knowledge, your wisdom, and your passion. And I look forward to more wonderful things to come in your career. We are lucky to have you and in our program, but just not only at a local level, but national level. And I will say from the bottom of my heart, it has been a pleasure to see you flourish throughout these last 4 years. And that's the cool thing about being a faculty member and attending what have you, is that you get to see the growth of residents when they come in intern year, and then as they're getting ready to graduate and go on to the next chapter of their lives. So I hope that you know that you are loved and appreciated by us all here in Greer, South Carolina, but that love extends across the country, and I know you're loved and appreciated by many. And a hearty congratulations to you again on being engaged. I had to put that out there for you. So,
Thank you, thank you.
yeah, absolutely. Well, ladies and gentlemen, this has been another episode of Psyched Perspectives. Until next time, take care of yourselves. Remember that vulnerability is synonymous with courage and strength. Be well, peace and blessings.